Hello and welcome to the PRN Medication Refresher in-Service for the Cedars Assisted Living. In this short presentation, we will review some of the best practices for PRN as-needed medications. This presentation was created by Brenda Chow at CareRx Pharmacy. As you remember, PRN means as needed. These are usually medications taken at different times throughout the day and sometimes not at the same time as their usual medications. PRN medications may come in pill form, liquid form, prescription cream, or perhaps an inhaler. We have 3 different levels of medication assistance at the Cedars. As you can see in this slide, it's the Assisted Living Registrar and Vancouver Coastal Health who determine the 3 levels of medication assistance we have at the Cedars. Level 1 means the resident is independent with their medication. Level 2, which is very common at the Cedars, means that the resident is able to do their medication with the help and support from staff. So perhaps we are doing a medication reminder, or perhaps we are checking their blister pack to make sure they took their medication and that everything is on track. Level 3, also very common at the Cedars, means that the staff administer and record and document medications for the resident. For these residents, their medication drawer is often locked. We secure the medication for safety. That's level 3. In this picture, you can see a blister pack. The blister pack will identify the resident, the medication name, and how often the medication is given and for what reason. So often the PRN as needed medications are found in a blister pack. Really, we should not be administering any PRN medications from a vial. Everything should be blister pack form for PRN as needed medications. If the resident can do the medication by themselves, then it is totally appropriate to have the medication in a bottle. We have to be careful when we are offering a PRN medication to check the MAR. Usually it's the second page of the MAR that lists the PRNs and when they can be given. You can also refer to senior care for the PRN care plan, and I will show you that in a moment. We need to be careful that we're punching out the amount that is correct from the blister pack. Please do all of your 3 checks to make sure it's the right medication to the right person at the right time and also for the right reason. You might notice that some medications are PRN, but they're also in their medication roll. So sometimes, say, Tylenol might be in their regular medications, but they have extra Tylenol for days that they have more pain, and this is part of their PRN care plan. That's why we have to be so careful when we are giving medications to ensure that we're not giving too much of any medication. Zoplicone, as this slide shows, is a commonly prescribed PRN medication that might also be in the regular medications in the roll. So that means we have to be very careful if we're going to give extra Zoplicone if the resident already takes it as part of their regular routine. Please also remember to check the expiry date on any PRN medication you are helping with. If we're going to help with the PRN medication, we must make sure the name of the drug, the route of administration, and the dose is indicated on the MAR sheet and on the blister pack or bottle. PRN medications usually say how often can the resident take the medication. So for example, Tylenol might be given 1 tablet every 4 to 6 hours, and then Later, you would give it again after 4 to 6 hours has passed. Examples for PRN medications. Sometimes the instructions will say something like, take 1 tablet every 6 hours as needed. So, because there's specific instructions and there's a time frame, it is really important that we document on the back of the MAR sheet what time and what medication we help the client with so that the next staff member can administer more PRN medication safely. So when we help with a PRN medication, you can initial here on the front page of the MAR, and then you have to turn the page over, and then you have to sign on the back page. So you're going to sign twice, in the little box on the MAR and on the back. The usual minimum amount of time between PRN medications is 4 hours. So if you give a PRN Tylenol at 8 o'clock, the next one is usually around 12 o'clock. This is the most common practice. Nurses are responsible for helping with PRN medications and supporting the ALWs when you have questions. This is actually the expectation and rule in assisted living. When the nurse is unsure, then we contact the pharmacy for support. The following slide contains something new in terms of PRN medication. As of this fall, October 2020, every Cedars resident has a PRN medication care plan. A care plan is needed for every PRN medication that the resident has. Here is an example from senior care. When you look at your scheduled services, the care plan for the resident, and you click on medication assistance, and you scroll down, you will see which staff members are responsible for helping the resident with their medication. And then at the bottom, you will see the special medication instructions. For this resident, I'm looking for their medications. I click, and there, for this resident, I see they are level 3, and the PRN medication they have is Ketoderm Cream 2%. Apply to affected area on the groin and perineal area. So that is the example for that resident. Here's another resident. If I click, and this resident has actually quite a few things in their medication care plan. They have Tylenol, they have a prescription cream, and they have Benylin cough syrup. So in senior care, you can see which PRNs they have. So if your resident isn't feeling well, you could refer to senior care to see if there's a PRN medication that might help them feel better. When you're helping with medication, please remember there are 7 rights. We want to make sure we have the right resident, the right medication, for the right reason, the right dose, the right time, the right documentation, and the right route. Please always do your rights and your 3 checks to make sure that you have been very careful when administering medications. The best practice is to have the MAR in front of you when you are preparing the medication and check it very carefully to make sure you have the right resident, the right time, and the right amount of medications. You can always check the back of the MAR to see if a PRN was given. So in this case, on September 17th at 8 o'clock, a Tylenol 325 mgs was given for pain. Please try to follow this and always check, and we can see which residents are using PRN medications often. So just again to review, you initial on the front of the MAR for PRN medication, and then you sign the back, you document on the back. So in the future, the pharmacy will be checking to make sure we are using the back of the form just as much as the front of the form. We document on the back page the date, the time, the route, the name of the medication, the reason. If you can put the result, but this is really the responsibility of the nurse to determine if the medication is effective or not. So sometimes you'll see the nurse will sign effective or not effective. Please speak to the nurse or the clinical lead if you have any questions about documentation. And here's a few more tips for you. We never wait to document. You should do your documentation after the resident has swallowed the medication. If you didn't document, it means you didn't do it. This is standard in healthcare. So remember to always sign this. This is a legal document, the MAR sheet. And this should always be up to date. So if you see something that doesn't look right, please let the nurse know. If you make a mistake, please just do a single line. Don't use whiteout, don't scribble. It's actually best practice to use black pen. If you need a black pen, please ask the general manager or Samantha or the clinical lead. We can give you a black pen for your documentation. And also, because we're in a pandemic, please avoid sharing pens as much as possible. Also, we should avoid using abbreviations in healthcare. Try to write things out as much as possible and make sure your writing is clear and easy to read. Thank you for watching this presentation about PRN medications. If you have any questions or concerns, please talk to your supervisor or talk to the nurse on duty. And thank you for all your help for making medication assistance very safe here at the Cedars. Thank you.